Why was DayHab created? Well, funnily enough, DayHab was born out of resentment. And as a professional that's been working in the drug and alcohol field for many, many years, I got continually disheartened with the services that were available. I started my career working in the public sector, and although it was great, there was kind of, it was good for clients because they could come in and it wouldn't cost them anything. Unfortunately, they would get involved in a bureaucracy, and everything took time, and nothing joined up. And by that, what I mean is that people would come in for rehab or come in for drug and alcohol help. And as a drug and alcohol worker, I was unable to get them into a detox or unable to get them into a rehab in a timely fashion. It would sometimes take months and months and months. Government demands that a public-funded treatment service must use a model of care called harm minimisation. In the drug and alcohol field, we know that harm minimisation, although it has its benefits, in terms of drug and alcohol treatment, it's horribly inadequate. So that's kind of the disheartening part that I got kind of working in the public sector. And then of course I moved over into the private sector. I started working for some private facilities, and in these facilities what I found is that the model of care was much better. It was what we call a recovery-based model of care, and we found it very effective, and that it was very accessible. So if someone wanted to enter the service, they could enter very, very quickly, which is also a really good thing. But unfortunately, unless a person had private health cover, it was almost impossible for them to enter that program because of the exorbitantly priced fees to get into these places. So, I decided that I would do something that was never really been done before. What I wanted to do was I wanted to, I guess, bypass many of the negatives from the public sector and the private sector and accentuate the positives from both those sectors. And both of them have a lot of positives. And I wanted to kind of put them into one and create a service that was second to none. So what I was able to do is create a private facility that was not attached to any hospital or any other major company, which means that I could build a standalone service that could deliver the model of care that I know and my experience of 15 years of working in the field that I knew worked, and I could create it so that it could be accessed during the day, yet people could go home at night. That's really how DayHab was born, from that kind of standpoint. And we had a great response. I mean, people were really interested in coming and getting the full rehab experience. So not a watered down service, not something that was kind of, like, little bits and pieces, but not really a program. What we wanted to do was to create an intensive, high quality addiction treatment rehab where people could go home at night. And we achieved that. And the results are evident now. From there, of course, over time we've expanded and we've kind of moved into different areas, and DayHab's moved into the residential side of treatment as well. And we wanted to make sure that every step along the way, that whatever service that DayHab delivers, it delivers with excellence.